Bismillahirrahmanirrahim. A 23-year-old preemie gravida at 38 week of gestation come to the emergency department for spontaneous rupture of membrane and painful contraction. The patient has had uncomplicated prenatal course and had a negative group B Streptococcus culture last week. Leopold maneuver show an estimated fetal weight of 3.6 kg. Cervical examination show the cervix to be 8 cm dilated and 90% effaced with the head at 0 station. The patient is admitted. Epidural analgesia is administered, after which the patient report increasing rectal pressure. Cervical examination at that time is unchanged. An intrauterine pressure catheter revealed contraction every 2 to 3 minutes. The sum of contraction strength over 10 minutes is 220 Montevideo units. So, what is Montevideo units? Montevideo unit is the peak contraction pressure minus the baseline intrauterine pressure determine the number of Montevideo units for the contraction. Contraction generating more than or equal to 200 Montevideo units in a 10-minute interval are considered adequate. So this patient contraction is normal. 4 hours later, the cervix still remain unchanged. Fetal heart rate tracing is normal. Which of the following is the most appropriate next step in management of this patient? A. Immunoinfusion. B. Cervical examination in 2 hours. C. Cesarean delivery. D. Intravenous oxytocin. E. Operative vaginal delivery. So I will write here that when the patient come, she having spontaneous rupture of the membrane. Spontaneous rupture of the membrane. This is the first hint. The second hint is that at that time cervical exam or on that time the cervical examination show so 8 cm dilation. And when the patient is admitted and when the epidural anesthesia is given, at that time the cervical examination show no dilation, and the cervical examination show no dilation or remain unchanged. After 4 hours. 4 hours later, still the cervix remain unchanged. Still cervix remain unchanged. So from this, based on these 4 hints, this is the diagnosis of this question is that this patient have active phase arrest. I will explain to you that what is active phase and what is latent phase arrest. So this is active phase arrest, and based on when the patient have active phase arrest, we will go toward directly to the cesarean delivery, choice C. So on this question, the choice C is the correct one. Why the choice C is the correct one? Because cesarean delivery is the first cesarean delivery, because the first stage of labor begins with the onset of regular contraction and ends when the patient is 10 cm dilated. It consists of a latent phase involving gradual cervical dilation and an active phase with rapid dilation. The transition between the latent and active phase typically occurs at 6 cm dilation. Patients who are more than or equal to 6 cm dilated with slow dilation or absence of further dilation, for example, labor arrest, have an active phase abnormality. Arrest of active labor occurs when there is no cervical changes for more than or equal to 4 hours. As already we can see here that this patient has no cervical changes for more than or equal to 4 hours. So with adequate contraction or no cervical changes for more than or equal to 6 hours. With inadequate contraction, this patient has arrest of active labor, as she has had no cervical changes in the 4 hours. Despite adequate contraction, cesarean delivery is therefore indicated. So the choice C is the correct one. Come to the choice A, immunoinfusion. So Immunoinfusion involved the installation of fluid into the uterine cavity to treat variable deceleration, but this patient has normal contraction and normal deceleration, so no need to administer immunoinfusion. Choice B, cervical examination in 2 hours. This patient already meets criteria for an active phase arrest of labor, which should be managed with cesarean delivery. Choice D, intravenous oxytocin. As we already know that oxytocin is indicated for protected labor caused by inadequate contraction strain. This patient contraction are adequate, so no need to administer intravenous oxytocin. Choice E, operative vaginal delivery. So, operative vaginal delivery can be used to manage and protect the second stage of labor when the cervix is completely 10 centimeter dilated. This patient is still in first stage of labor, so no need to go toward the operative vaginal delivery. So here the correct option is choice C, cesarean delivery. Why choice C? Because as we already know that this patient has no cervical dilation. When the patient comes to the office on cervical examination, she having the cervix to be 8 centimeter dilated. But when we admitted the patient in after 4 hours, the patient cervix remain unchanged and no dilation further occur. So therefore this is the active phase arrest, and based on active phase arrest we will go toward the cesarean delivery.